Hi everybody, welcome. I'm Dr. Kimberly Queen, and I've been with the program for about 5.5, 6 years now. And I teach many of the clinical courses. I'm a doctor of chiropractic. Also, I am a certified nutrition specialist. And I practiced for about 23, 24 years, doing both clinical nutrition and doctor of chiropractic. I'm also a diplomat with the American Clinical Board of Nutrition. I have been on the American Nutrition Association board for doing item writing, which is for their examination for the CNS, and also evaluating clinical nutrition education for the diplomate of the American Clinical Board of Nutrition. And so we have a certification program that is integral to our program, meaning that you would basically qualify to sit for the CNS examination once you have graduated from the master's degree program. So you need a master's degree to qualify to sit for the CNS program. So some of you might be interested in just a bachelor's degree program, but we have what's called an accelerated program where you can go from bachelor's to master's, and then you would also qualify then for the CNS. So if you're just thinking bachelor's, I'm encouraging you to think master's, okay? And I'm gonna share with you why that's important and why this certification program is a valuable little extra feather in your cap when you get out there. And the reason is we are really working on advocacy to help nutritionists become licensed in states. And I'll tell you why there's a difference between an RD versus a certified nutrition specialist. Because I think that's the main question that I get with new recruits that are coming in. It's like, well, why do I need to also do that? I just spent all this money getting my master's degree, and now you're telling me I've got to get this other certification. And the reason is it's because it's starting to become recognized by states for you to get that additional advanced degree in nutrition or advanced certification. And what it does is it leverages you for jobs out there and to compete with registered dietitians. And that's what we're looking at, is you want to put yourself in a position where you can have the kind of the best leverage to get in and be recognized. Plus you use it as a marketing tool. They have all kinds of webinars, all kinds of marketing ideas and communities, Facebook pages and things like that you can network to find out. And it depends on what state you want to practice in also, and what scope of practice that you want to utilize. The certified nutrition specialist will help you with that and advocacy. So I'm going to take you through, some of you may have already seen this. I know Nicole's probably has given, have you guys seen some of this information on the CNS a little bit? No, it was yes and no. Okay. Well, I'm going to just take you through it again, okay? This was established in 1993, and it's under the umbrella of the American Nutrition Association. They administer the CNS, and many of our graduates will go on to get their CNSs. In fact, Jamie Menzel, who is a graduate of a program here, you just got your CNS.
Yep.
Yes, congratulations. How does that feel?
Amazing.
Yeah.
Amazing.
Yeah. And was the test hard?
Yes.
Yes. Okay, so not to make everything sound fluffy like a marshmallow sandwich, but definitely it's a lot of work to do this program, which will take you, if you do start with your BCNS to your master's, it will take you at least 3 years to get through that, and then just 2 years for your master's, and then doing your CNS. And I'll show you why, because you need to have supervised practice experience also, which is 1,000 hours on top of your master's degree. Okay. So I'll talk a little bit more about the American Nutrition Association and the CNS. I'm going to tell you a little bit more about what is involved in the CNS. And the American Nutrition Association, they really have brought in evidence-based nutrition, right? And that's what RDs really touted for a long period of time that we're using research to really advocate for nutrition. And as a CNS, what I like about the CNS versus the RD program is you're going to be doing more of a holistic approach, more personalized nutrition. Instead of working in a hospital and really focusing on a formula or energy, you're really going to be personalizing it to the individual. And I think maybe that's what drew some of you here to do more of a holistic approach, right? And that's what the American Nutrition Association, their same philosophy. So that's what we liked about it. And we liked it because it augments not only our program, but it's easily integrated from with the didactic program and the curriculum that we offer. So basically, this is offered through the ANA, and our coursework here at this program will qualify you to sit for it, but you also need that 1,000 hours, and then you need to sit for that certifying exam at the end. Okay, so there's 3 components. Your education, which is the curriculum here, will qualify you, your 1,000 hours, and then the exam. Okay, so those are the 3 components. Do you have a question?
You said your curriculum here, but I'm just wondering about curriculum elsewhere. If you have a master's in public health, would you still sit for the CNS?
Yeah, what's your name?
Andrew,
I'll talk about that in just a moment. There are some programs that will also qualify at healthcare. And if you already have maybe a public health, there might be just maybe 1 or 2 classes or a few more classes that you'll need to take, okay, to fulfill the requirement for the CNS, okay? Okay, so basically we are going to be talking about how the CNS is science-based, it's personalized nutrition, so you're really working with individuals who might have a disease or a condition, and you want to really make sure that it's not a one-size-fits-all type of personalized nutrition plan that you are prescribing for your client or your patient. And so the CNS also gives you a little bit more authority. It kind of ups your status, and it demonstrates to your colleagues. And I'll tell you, the most important person that it demonstrates to is your family members, right? It shows them how important you are, and that actually it's not just a fluffy degree that you're going for, okay? And even though you're not going to be doctors, you will be doctoring. You will be doctoring because you're going to be in healthcare. That means that you're going to be teaching others and educating them on nutrition. And so this will help you develop knowledge and proficiency in skills in clinical nutrition. And it also is accredited by the National Commission for Certifying Agencies, which is the same body that qualifies RDN program individuals who graduate from the Ascend program, okay? Also, RDs didn't used to have their master's degree. They only used to have a bachelor's until this last year. Then they needed to get their master's degree. So actually we were a little bit above in our knowledge and our curriculum and the things that we offered versus RDs, but now they are kind of on par with us a little bit more. They require that. So once you graduate from a master's degree program in nutrition or in a specialized healthcare profession that qualifies, then you need to do 1,000 hours of supervised practice experience. And we do offer an internship through our curriculum in your second year here in the master's degree program. We have what's called a capstone, where your capstone will give you about 72 hours per term towards the CNS, okay? And it can be either direct hours or indirect hours that qualify you. And the hours are categorized into nutritional assessment, interpretation, which also includes nutritional diagnosis, intervention, monitoring, evaluation. And we cover a broad range of diseases and conditions, and we also use food as medicine to do that. And that's one of the things that sets us apart in this program, is we're using culinary nutrition to help mitigate diseases and chronic conditions for individuals by using foods that have bioactive ingredients in them that can help with a person's health status overall. The CNS also is an avenue for you to obtain licensure in many different states. And on the American Nutrition website, they have at the top is an advocacy. If you press on that, they have a map of your state. You press on it and it will take you to their scope and or their legislative rules of what they accept. Now, just for Oregon, they don't require licensure in Oregon. But if you do want to get licensure, they only have a licensed dietitian, and they have the licensed dietitian board here. And what you can do is you go to Washington, you get your certified nutrition certification there, and then you get reciprocity here in Oregon with that certification, and then you can get your licensed dietitian. And that's what I just did to show students how it's done, okay? Even though I've been a doctor for many years, there's a difference between what we call a physician nutritionist, which is what I am, versus a non-physician nutritionist, just to kind of delineate that out for your understanding, okay? Many individuals who are wanting to do the program, they want to know what jobs are out there for me, right? Because all you're going to see a lot of time is RD jobs. Well, we have many students who graduated from this program who are working in public health, who are working in academia. Actually, they're teaching at the university level and community colleges. They're also working maybe for nonprofits, maybe doing culinary nutrition, or they're maybe doing gardening, or doing farmers market type work, or working with social justice, and or in BIPOC communities that are underserved areas. So there's a lot out there, all right? And our internships through our capstone and through our clinic rotation will connect you with these certain organizations. A lot of these internships actually turn into careers or jobs for our graduates. So there's a lot out there, even though you may not see it on the career path or the career websites, they're out there, and we help develop that and help you get aligned with wherever you want to go. A lot of times, though, I find students change their course kind of after the first or second year that they're here. You know, they think, oh, I'm just going to do this, and then all of a sudden, you know what? I never thought I'd do clinical nutrition, but I love it. And so they go into, or I think I'm just going to do culinary nutrition. So, you know, there's that option for you. And then in this, what I'll do is I'll make slides of this. It has a few links in here. This is a nutrition professional focus document. It shows all of the different careers out there for you. You could work also in, for businesses, doing career nutrition. A lot of insurance companies like to have nutritionists on staff, and they'll offer lower insurance rates for their employees who do nutrition programs. So you could do that. You could work for the VA, HIV/AIDS organizations. So there's a lot of things out there. Military. So it depends on what your personal sort of career choice is. What's nice, though, is you're all coming in with something that you've already kind of know what you're doing or know where you want to go. And that's really important, too. Or you're bringing in, maybe you did a career previously, and you might springboard off of that. You might want to follow up, and maybe you have some networking already out there from what you've already been doing. Okay? So basically, you're going to be on the front lines of medical nutrition therapy, and if you do get a license in your state, that means that you can do billing, third-party billing also. Right now, many states, though, don't allow you to do that or even say that you do medical nutrition therapy unless if you do have a CNS, okay? So that is another advantage, too, if that's another place that you want to go. A little bit of history about nutrition practice. In 2011, the American Dietetics Association, they basically determined that state-level nutrition licensure was a mega issue for them. So what they did is they developed strategies to develop exclusivity And that's what you're seeing right now, is there's exclusivity where they're only going to hire RDs a lot of times. And so we call this scope creep. And scope creep is just this euphemism for this competitive threat. It's a turf war. It's a turf war out there. And so you're going to come up with that, against that when you get out there. And then in 2012, the ADA actually took on the name nutrition, okay? So they decided, well, we're going to be the Academy of Nutrition and Dietetics then. And so we're going to try to own nutrition. But on a federal level, they said, sorry, you can't do that. So through Medicare and Medicaid, nutrition, you can't own the word nutrition. And so now they recognize all nutritionists. And the Academy also, they added on what's called licensed dietitian nutritionist also to the back of their name. And they did that to try to defend their boundaries. And they wanted to make sure that there was no scope creep from other nutritionists out there, okay? And it's paid off. They really have organized quite well, right? And so what happens is only a few, it's actually happening more because we're really working hard for advocacy to get licensure for nutritionists and CNSs. In fact, I was just on a task force where we are getting the supervised practice experience accredited. And that means when you go to a state and you challenge state boards, you will no longer have to do that if you actually are from an accredited program that does supervised practice experience. Then they'll recognize you. You don't have to actually send them all your transcripts and show the proof that you've had all these courses and that you're actually at an equal or higher level than most RDs. Okay. Is it easy? No. So I'm just giving you the kind of the raw truth of it. It's a little bit more work, but it's worth it if you want to practice holistic, more advanced nutrition. That's not just in the box type of diets that you're delivering through a clinical setting, okay? And then also, again, clinical practice, billing and coding insurance, you are become, if you get licensed, then you can do what RDs do. Here's the difference, okay? You're going to be highly qualified. You are recognized by many states and by different federal and government institutions, whereas the registered dietitian is just more food and food delivery. All right, they did more just food delivery, food safety, those types of things, where you're going to be really working and assessing a person's diet and their clinical status. And so this is where the doctoring part comes in clinical nutrition, okay? And so you're going to be really focusing and be trained in this program for advanced personalized nutrition and healthcare, if that's the route that you want to go. Okay. Whereas the RDs, they basically look at sanitation, freshness, they focus on calories and energy, meal planning, which we also do meal planning, and basically they're using specific diets that are kind of these tailored in-the-box diets based on My Plate and other guidelines, where we used foundational diets that we modify, like the Mediterranean diet, the DASH diet, things that have been proven in research, vegetarian diet, plant-based diets. And so we modify those based on what our individual patient might need, okay? So just really quick, in summary, this is the column that you want to look at, and it just, your degree, which is a master's degree, the coursework, which I'm going to show you in just a moment, your experience, your 1,000 hours, and then the examination that you'll have to sit for. You do have to do some continuing education, 75 hours for every 5 years, which is about 15 continuing education credits per year, okay? All right, this is their link for their curriculum overview. You have to have, be in a program that has 35 semester credit hours. We're on the quarterly hour system, so we have to convert a lot of our credits into semester hours, but we do meet all of the CNS requirements for the curriculum and the foundation for that, okay? And then I have a document of all the courses that qualify for the BCNS. And this includes all the core courses on the top. You can't read this, but if you click on this, whenever I give you the slides, you'll be able to see all of the courses that qualify for you, okay? And then all of the electives also that qualify. So you have some flexibility. You're not going to be funneled, oh, you know, you can't take this or can't take that. You'll have some flexibility in what you can take that will still qualify for the CNS. Okay, so this is a breakout of the supervised practice experience, okay? And for the first part, which is the nutrition assessment and also interpretation, those first two categories, you need a minimum of 200 hours for supervised practice. And then for the nutrition intervention piece and ongoing care, this is 200 hours, and then monitoring and evaluation is another 200 hours. And then the remaining hours, so that equals 600, the remaining hours, 400, can be in any one of these categories, okay? So that just kind of gives you a breakout of that supervised practice experience. So the types of experience that you can earn, it can be either observational or indirect, meaning you're not actually doing patient care directly. You're not educating, or you're not counseling, or actually doing an evaluation with a client. You're just observing somebody else do that. And so you can earn up to 250 hours maximum doing observational. And then the other types of experience is what we call direct hours, okay? Is direct hours. This is where you have direct contact with a client or a patient or a potential client or patient. You might be doing an educational webinar or seminar, and if they're potential clients, then that can count as what we call direct care, okay? Because they're eventually going to be your client. But you can't just do a blog or put together maybe a personalized nutrition plan for somebody else, another doctor per se, and have that count as direct.
When you're observing, can you pick who you observe, or do you have to tell us who to observe?
No, we don't tell you who to observe. You can pick whoever you want. If you're already networking with somebody in your community and it's part of your capstone internship, yeah, not a problem to do that. Or you can go over sometimes and do observation in our clinic here on campus, okay? Or you decide you want to do a rotation.
Does the capstone usually fulfill that many, all the hours, 1,000, or do you have to go outside of that?
Yeah, we have to go outside of that. We can only offer, let's see, 72 a quarter, so in your last year, you're gonna have, what, 3 quarters? So you may only earn up to maybe 200 of those hours, but we have a postgraduate internship. If you wanted to stay for another year after that, then you can earn more of those hours, up to half of them, but we're trying to work on getting all of the hours within that internship, that postgraduate after you graduate. We're trying to make them maybe fit that in for everybody. But the thing is, you have to be on campus here in Portland. So we're not really offering it to individuals, yeah.
How much assistance is there for finding the direct observational hours when you're out of state?
Yeah, when you're out of state, that's harder for us to help you with that. We do have some networking and connections, but you really need to, you're gonna be doing a lot of that on your own. Yeah, and so that's why in your first year, or towards the end of your first year, we have a career development class, and that's the time you're gonna start to need to reach out to people in your community. Yeah, to help with that. And then we do have some contacts that other people have worked at certain situations. And Kira, who you're going to meet next, who does all of our kitchen coordination and all of our coordinating through our department, she helps set up those internships. And so we can hopefully connect you somewhat, but sometimes if you're in a rural area, yeah, then sometimes we can't always do that. Yeah. Okay. Okay, so this is about just the SPE program, a breakdown of that. This is through the ANA website, so if you want to find out more information. And then the competencies that you'll have to meet within those 4 categories. So that's another resource that you can look at. Okay, and so again, you can get part of it from an internship or entirely from an internship, a residency, a clinic rotation, clinical practice setting, or community setting. Again, with an institution, maybe a healthcare setting. So these are all different ways that you can achieve a supervised practice experience. Okay, and your supervised practice experience has to be with a supervisor who has been approved by the American Nutrition Association. So if you go out and you network with somebody, they have to just fill out an application with the American Nutrition Association and become qualified provider to supervise you, okay? Because they're supervising not only your work, but how you're documenting the information and the types of conditions that you're going to be working with. Okay, so here you have to get your supervisor approved. And there's also different forms that you have to fill out, and then you have to track all of your hours. How was tracking your hours, Jamie, on, was it easy to do or hard to do?
It was super annoying, but it was easy to do. I would describe it as burdensome.
Yeah, burdensome. Because you have to be very detailed. You have to log in each client that you're working with, the type of condition that you're doing, and the type of work that you're doing with them, right? And the things that you prescribed, your treatment plan, etc.
It's also kind of interesting because you get to track your own experience. So it was kind of valuable
Yes.
that way too, of being able to identify gaps in your own knowledge and experience and then really aim to fill those just for professional growth. So
Yeah.
there was value to it aside from just the submission part of it, but it did take time.
Yeah.
How long did it take you to complete your 1,000?
About 6 months post graduation.
Yeah, Jamie's a kind of a super student. I would say she completed it probably faster or on track more than some of the other graduates. I'd say up to a year is typical. Usually students graduate like in June, and then they may take the exam in June of the following year. Yeah, because they do encourage you that you go out and get experience to feel like you're ready to take the exam. For me, I took it right away. I took it 3 months after I got done with my program because I had already been in clinical practice. So unless if you already are in healthcare, I'd say you want to wait and probably that year and then take your exam. Because it's a practical exam, it's all, the cases aren't, it's not just multiple choice. It's going to be cases that they're going to give you. So, you know, they're going to give you an example of if so-and-so comes in for this, what type of lab test would you order? Or if somebody comes in, what would you prescribe? What type of supplement for this condition? You know, so it's all very practical type of questions. Would you say that that's true?
Yeah, although mine, it was all multiple choice, but it was very granular and it was case-based questions.
Yes, case-based questions. I guess is what I'm getting at. Yeah, of course, it's, yeah, multiple choice. Yeah, okay.
And timed?
Yes.
And timed,
Yeah.
and timed.
Are the supervised hours in the internship generally unpaid?
Yes. Yep,
Okay.
yeah.
Always?
Yep,
Well, I would say probably most of the time, I actually got paid for the second half of my hours because I got work at a clinic in town, but for all of my hours when I was part of the program here, unpaid because I was a student.
yeah. Yeah, until you probably graduate and feel ready, then sometimes the internships will hire you and then you can be paid then. So you're gonna rely on your student loan and maybe have to do a work study, you know, get a work study on campus or have something outside, gig. That's what I had to do. I had to work in the library or do research, do work study to help fund my education and be able to buy books, right, and eat at the same time. So depends individually what you want to do. Okay, all right.
That's where intermittent fasting comes back another full.
Say that again.
So that's where intermittent fasting comes back.
Yes, intermittent fasting, and yes, that's so true. Definitely. definitely you're going to be probably at the less weight that you've ever been.
You're a man, we need to be scored.
Yeah, and there's is SNAP program, so that, you know, if you need to be on food stamps, that also is another source, and that's what I had to do whenever I was in school, you know, so. So here's the clinical nutrition internship program that we run postgraduate. So this is our program that we just started last year for students. They can stay on campus and continue doing their supervised practice hours here so they don't feel like they have to go back out. And then also the ANA helps you find a mentor in your state too. So you can contact them if you need a supervisor. They can say, hey, yeah, Dr. So-and-so, or there might be another CNS in that state who might help you. And then these are independent programs. These are individuals that I've worked with. The Nutrition Collaborative, this is Alana Bodner. She has a supervised practice experience program that she runs. So she has practitioners that she can send out and work with you in different states. Same with the Nutrition and Herbal Collaborative. This is Rebecca Snow's program. Same thing, they have practitioners within their program. And then the Clinicians Incubator, this is Meg Bowman. She's out of Illinois, and she also has a supervised practice experience that can help you. If you can't find a mentor, this is another avenue that you might want to go, okay? There is a cost. You do have to pay for this to help, and they also help you study for the CNS exam at the same time. Like Alana Bodner, her program, she has like a 99% pass rate, okay? We have a 92% pass rate, so, you know.
If you follow the internship.
Exactly.
Got it.
Yep, okay.
Any others in the Portland area?
And the other supervisors or programs?
Yeah.
You know, we have a Facebook page, and I have a mentor that I'll connect you with, okay, also. Okay, so here is the examination is offered twice a year, once in December and once in June, okay? So it depends on when you want to take it. And there's 200 multiple choice questions. There's single answer questions, but again, most of them are case-based. And let's see, there's a nominal fee for a test center, okay, that you have to go to. I did mine out at UWS, where I graduated. Where did you take yours? Do you remember?
I think it was in Vancouver. Or no, it was in Portland, but it was pretty far north.
Okay.
Yeah, there's a spot in town.
Yeah, okay. Again, here's the forms overview connection. This is how you apply. And if you apply early, even if you're not ready to take the exam, you can actually see, they'll give you some forms and information that you can go to their website. You don't have to become a member or pay or anything like that. So you might want to sign up early, okay? And there's a portal and an exam application fee is $100. The exam fee is $400. If you have to retake the exam, it's $200. And there's new CNS exam content that they'll give you study guides, different books that you want to study from, but sometimes there's just not enough, okay? What I do is I try to connect my graduates with people who have already taken the test to help, you know, with what did you use, how did you study, what type of information is on the test, because the more you know about a situation, the less anxious you get, and the better you'll perform on a test also, okay? And then here's CNS scope of practice. This is really important information. This also gives you about what you can do as a nutritionist in your state, and it also gives you different job opportunities and different job ideas, okay? So that's another nice link that you want to look at. And then just finally, Amy Smith, you can contact her anytime. She's the director of the certification program for the CNS. She's really great to work with, and she is very informative. She'll help you, because sometimes you're going to bring in some educational credits that might qualify for the CNS, and you can ask her, hey, you know, I took this biochemistry course about 5 years ago. Is it going to still qualify for the CNS? Something like that, okay? And then she is also Director of Legislative Affairs. She knows what's happening in each state. Basically, what's happening as far as the statutes. Can I go ahead and challenge the board and send in my CNS stuff? Will it qualify me for licensure? And she'll say, yes, Georgia's just changed their rules, or sorry, North Carolina is still being stubborn, they're not accepting anybody yet, but we're working on it from an advocacy standpoint, okay? So that she's a really great person that'll give you information. And then here's Alana Bodner. She works with all the state mentorships, and Ida Sadecki is our Oregon State mentor. She can help you. She put together this guide to how to get your CNS licensure in Oregon. So these are really good contact people if you're really interested on going this route. Okay, that can help you. Any questions? All right. It's a lot of information. I went really fast too, right? Yeah. Yeah, I'm sorry.
I'm kind of curious what people do when they don't want any clinical work, but
Yeah.
they still want to pursue this.
Yeah.
Like what? I don't know.
Yeah, there's chefing.
Yeah.
There's a culinary nutrition. You can work with nonprofits going out into farmers markets. There's a lot of nonprofits, again, that do social justice. Have individuals who are working in public health and working out with underdeveloped communities. I have an individual who, Hood River, she is working with the mobile farmers market out there, and then she's doing culinary classes. And so there's so many things. In fact, that's part of this. You don't have to go clinical. You can go culinary environmental, or you can do clinical community, either one. So we have those different tracks.
Does anyone do like product formulation? Or
Say that again?
Product formulation?
Yes, innovation, yep, product formulation and innovation also. So if you've got something, we've had the cricket production and innovation for cricket spices, doing insect type culinary food. Yeah, all kinds of stuff.
OSU has an innovation center down on Needle Parkway.
Mm-hmm.
Wow, I mean, I don't know if it's nutrition, but that's a, yeah.
Yeah. So there's definitely the innovation piece. We have several who've done innovation on fermented foods. Do you know of anything else, Jamie?
As far as innovation goes?
Yeah.
Cricket salts was the only thing that came to
Yeah,
mind.
cricket salts.
But in terms of the nonprofit thing too, it can be really all over the place in that way too. Like one of my classmates who graduated at the same time, she's like the regional leader of Head Start, you know, and she's doing something really cool. She didn't think she was interested in community nutrition, was thinking to go clinical, but over the course of the program changed her mind and is really loving it. Paid very well doing it, which is nice. And so it runs the gamut, community, culinary, clinical.
Yeah, environmental. I have several graduates who actually have their own farm, and so they're doing maybe some bringing people into their farm and showing them how to do sustainable farming, and then also teaching classes on culinary at the same time. So yeah, there's so many options out there. So that's an excellent question. Yeah, but what's available?
Do you feel like you are going to do the licensure path that
Yeah, go ahead and put it on. Yeah.
that Dr. Queen was explaining, like going to Washington and coming back and trying to do that? Do you feel that pressure?
Yeah, can you guys hear me okay? It says it's on.
Yeah, I hear you. I hear it when you tap.
Okay. Yes, I did do that actually.
You did that.
I'm expecting to hear back from the state of Oregon today or maybe Monday. And I decided that early on because I was really intentional about wanting to provide clinical care to lower resource folks. And so for that, I needed to be able to become insurance credentialed. And so it was sort of a long time coming, but the CNS certification was the important first step. And then I did get my certified nutritionist licensure in Washington. And then so I submitted my application to Oregon a couple weeks ago, and everything should be set up. But then you have the process of becoming onboarded with the insurance, so it feels like one of those things where one thing after the other. But it's really nice because then clinics in town who are trying to operate sort of an integrative health clinic, like where I work now, bringing you on board already in the system are going to be able to see you without having to pay out of pocket. And I just feel like it widens the pool of potential clients if you're not only relying on cash based. Yeah.
And how long did that whole process take?
I graduated last June and I sat for the exam this December and I got certified in early January. And so I should expect to hear back from the state of Oregon probably maybe now, so I would say about 8 to 9 months. Yeah. But that was, to Dr. Queen's point, pretty fast. I was really lucky. I got hired at a clinic that was actually different than my internships site, but got hired at a local clinic, and then I just really hit the ground running, and I was really trying to work as much as I could to expedite the process. So I think expecting it to take a little bit longer might be prudent, but yeah, I just was one first topic doing it. So
Yeah, okay. Thank you.
yeah.
Any other questions?
Can you help break down, like, with the CNS certification, what does that, like, certify you to do, and what is gatekept in a way, like, through the certification versus, like, you know, maybe in your personal practice or a business or product development, like, the certification lends credibility, but what is actually required, like, for what avenues, career avenues, services do you have to have the certification?
You have to have your certification if you want to perform medical nutrition therapy. And
be at a clinic?
yeah, at a clinic or even in your personal practice. If you have a private practice that you wanted to open up, or even working with an ND or a DC or a medical doctor, and you need to do medical nutrition therapy, then your CNS will help you, will allow you to do that. And third-party billing also, just like Jamie was talking about. And so, and it'll also allow you to get your licensure. It'll help you get a licensed, what we call dietitian. Even though you say we're nutritionists, you're still doing dietetics, right? So there's the semantics between terminology, and you're still doing dietetics even though you're a nutritionist. And so you'll be allowed then to qualify for a licensure in your state if you have a CNS, because that means you've done all your supervised practice experience, you've sat for a rigorous examination, and you have all of the degree in education to be able to deliver medical nutrition therapy, and to do the assessment piece also, to be able to assess your client and deliver or prescribe a personalized nutrition plan. If you don't have that, you wouldn't be able to qualify for licensure, you wouldn't be able to do billing, you wouldn't be able to do medical nutrition therapy. And so you're basically going to be relegated just to be a health coach. That's it. And if that's what you want, that's okay too. Because we have a lot of graduates who just go into health coaching.
And what is the cost that is added
The
for
cost.
the license, if you go for your license?
It's about $100, $110 for the certified nutrition specialist or certified nutrition, and then $100, I think $110 here for Oregon LD. And then that's yearly. It becomes a yearly or annual fee that you have to pay to stay licensed. And then you have to have, again, certain credits, continuing education credits.
But the going from here to Washington, right? What was the cost of doing that?
That was about $100, and then the plan for me never was actually to like practice clinically there, but just to open the door for reciprocity. But as I've thought about it more, I actually think it's nice, especially I work only via telehealth right now. It is an option in the future. I could open my practice and list on my eventual website, like I can see folks in Washington and Oregon.
Mm-hmm.
So for me, and like to your point, I feel like it's really just the licensure question. So if it just comes down to the job that you're hoping to get after graduation, and if it requires a license, it might be smart to think about the CNS path just to cover your bases and make sure that you have the opportunity to apply to any job in that area that you would be interested in. But there are a lot that doesn't require the license, you know. To me, it was sort of like a professional insurance. I was like, I already went this far, you know, and in Oregon, we're kind of at this tipping point where we're just starting to now recognize folks with this degree on equal footing as RDs, thanks to all the advocacy work that people have been doing. But that's also being seen in other states. So it feels like we're kind of on this precipice of things changing So to me, I just wanted to be a part of that.
Yeah, I think that's a really good point that you make, Jamie, is that we're on this edge, I call it the tsunami of nutrition, right? We're kind of on the top of the wave, and I think that my goal and the ANA's goal is to be integrated into primary health care. And if you set yourself up to be ready for that, then it's gonna give a whole lot more job opportunities out there. So instead of having to go back like the RDs did to get their masters, you already are set for that eventuality. Okay. Yeah, but there's no promises of that either, right? You know how long things take. We could say, oh, it might happen next year or the year after, but it might take 5 to 10 years to actually get there, but you'd still be ready for that moment.
Oh, you know, I actually just remembered an additional charge with Washington licensure because they require you to get fingerprinted.
Oh, yeah.
And I think that ended up being something like $40 to $50. I can't remember. It was like an annoying amount at the time, but it was.
Yeah. Okay.
Yeah, you usually have to go to the sheriff's department is a place to go, yeah, and have that done, yeah. Question?
Does the CNS license or the program or the it's kind of confusing, but so do you learn billing and coding yourself, or would you that like whoever you work for would do billing and coding?
I teach that in MNTN and my virtual nutrition clinic. So if you're an out-of-state student, I do teach a virtual nutrition clinic, and it's all telehealth based. And so we do teach you how to do the nutrition diagnosis, but we don't teach you the CMS 1500, how to fill out those billing forms.
Okay.
Wherever you go in a clinic, they'll probably teach you that piece.
Okay.
So that'd be something that you'd have to learn.
So if you want to work for yourself and you're on billing,
Yeah.
you don't get that in your master's, you don't get that in the
Yeah.
else.
We do have Dulcie Childs. She's our licensed nutritionist, dietitian. She teaches the clinic rotation on ground here. She does have a business of nutrition course that she does teach. Did you take that?
I did, although we didn't really talk about billing
Yeah.
actually in the class, but
Yeah.
something I told myself is that it is a knowable thing. So I started feeling like this is something people go to school for, learning billing, and I think you do in some cases, but a lot of my classmates were doing it as a part-time job, and I talked to some of them and they're like, it's actually pretty straightforward. If you were doing something where there's a bunch of different modalities and you're billing for, you know, a doctor and a nutritionist and acupuncture and chiropractor and trying to keep track of everyone's benefits would be one thing, but it's like, you know, 2 different billing codes.
So there's only like 1 or 2 codes, right?
Yeah,
Yeah.
and so and they're like, it's actually really simple, because I got really intimidated looking at it, because to me it looks like legal jargon. They're like, it's easy, so my plan for myself after talking to a few different folks in town who run their own businesses is just to watch some YouTube videos when I get closer, but as I work for a clinic in town, I mean, that's all taken care of.
Right.
I figured there's gotta be a third-party company that just does that for you.
They do. There's so many different ways. It
Not like a
depends
payroll
on.
company.
Yeah, it depends on your relationship also with your employer. If you're an employee, then they'll do it for you. Sometimes if you're an independent contractor, they'll do billing, depending on your contract you have set up with the employer. Or if you are a self-employed and you come in and work for a clinic, then you do have to do your own billing. And there are certain companies that do a warehouse. Office Ally will do billing for you. Actually, they'll do it for free if you join their organization. So, but you still have to enter the codes into an electronic health record
Yeah.
information, and then they'll kind of send it out to the different insurance companies that you're qualified or that you have enrolled in their insurance plan to become the provider for them. But there are only a few codes, ICD-10 codes that you'll be using to bill for nutrition, so it's not too complicated like Jamie said. Do you want to, anything else that you want to share?
I just showed up today in case anyone had any questions for me.
And how widely are the licensed dietitian services accepted by insurances now?
In my experience across the board, the difference is, for example, with OHP, which is the Care Oregon Medicaid here, it's no prior authorizations and no limitations for how often someone can see a nutritionist or a dietitian, which is really special. The reimbursement is worse than other insurances, but I love that there's no restrictions on that because it's so much better for developing a relationship with folks and working long term. Some other insurance companies pay better, but they limit it to 6 visits, we'll say a year.
A year.
Yeah, and so it really comes down to learning the nitty-gritty about the differences on. And sometimes that also comes down to the different diagnosis that's going on that someone's arriving to your care with, and that may entitle them to more visits. And so some of it's a little bit of a detective task to figure out what's going to work and how to best serve that client. But does that answer the question?
Yeah, sometimes you can get further authorization if somebody needs more visits, but then you have to fill out a progress report to show them that they're still making progress, but they still haven't met the goal, the nutrition goal quite yet. And so you just have to send them a little progress note to the insurance.
And that's probably similar to any other specialty.
Yeah, exactly, and that's what I used to do in chiropractic, right? Because we're limited for certain chiropractic adjustments, so many under their treatment plan. So what I did is I practiced chiropractic 3 days a week, and then I practiced nutrition 2 days a week. And so I wanted to make sure people knew who I was and what hat I wore on those days, right? Try to mix it up too much, but. And then there's insurance companies, there's Medicare, Medicaid you can belong to, they pay a little bit more. There's tribal companies like Shasta Insurance Company, they pay actually quite well. What they'll do a lot of times is they'll take the work comp fee schedules for workers' compensation or the personal injury fee schedules. And then if you look at that for each state, what the workers' compensation fee schedule is what insurance will pay. But if you're working for a health maintenance organization or belonging to them and you have a contract, they can actually deduct more than what the work comp fee schedule pays. So that just gives you some ideas. There's some hoops for sure. Yeah.
How was it finding jobs, like for you and your classmates post-graduation? Like what was that process like? People have trouble? Any insight there?
Yeah, that's a really good question. And I was in career development quarter 1 of year 1 of my program. I was very concerned about that. And they're like, you've got time. School's really started. And I was like, well, I want to make sure that this is going to turn into something. This is why I'm going back to school. And so that being said, I was really focused on trying to lay the groundwork for myself post-graduation. And what that looked like was taking every opportunity, knowing I wanted to go to clinic. I took every opportunity to do the clinical internships on campus here. And then for my capstone, I got an external internship in town here at a clinic that has the same focus as I was hoping to do professionally, which is on nutrition for mental health. So then post-graduation, the nice thing was that I had an opportunity to interview with them, but then also showcase that I had all these hours of experience to potential employers. And so I ended up having a choice, and I got to go with someone that I was pretty excited about and kind of worked for. Other folks felt like they weren't sure what direction they were going to go, and so they ended up graduating and being like, okay, well, I'm starting further back on my journey of getting CNS hours, or I need to start networking in this different way. So I would say, like, keep an open mind, but by the beginning of the second year, try to really have honed in on what you're trying to do post-graduation and make those connections while you can, because it can be really scary to be then like, okay, now I'm out in the real world and I have to start repaying my loan pretty soon. So.
How many students on average per class or cohort?
Since we launched our online program in 2019, and then we had the pandemic, we didn't have as many on-ground students, but when I first started here, I'd have 40 or 50 students in a class. But now I just have a cohort of 8 to 10 students on ground, but then I have 20 on my online.
Yeah.
Right?
From different states.
Yeah, from different states all over.
Yeah.
Okay, so on ground right now is kind of a good way to go because students get to come in and we get to practice a lot of our nutritional assessment techniques, develop proficiencies, feel comfortable about working together. A lot of on-ground students create lifelong friendships, and they are excited that everybody helps each other out, and they develop these relationships that they feel good about. But also online, they do the same thing. They have TikTok, Facebook page that they all kind of link together with, and so they're kind of communicating a little bit more on social media, but they still are connecting as a community also that way. Yeah.
What size is the faculty program? And is it all based in Oregon or out of state too?
Actually, we're just full-time. It's myself, Dr. Falk, and Dr. Erlinson. And then we have Dr. Galani, who is an MD. She also teaches some courses in the master's degree program. And then we have, I believe, 14 or 15 adjunct faculty. Okay, yeah, so probably about 20 of us who are teaching both in maybe the bachelor's and master's degree programs. Yeah.
I guess for both of you, how are you and your classmates and your colleagues feeling about your like income prospects, especially compared to your student loans and like what it's cost to get into this field? How confident do you feel that you're? I mean, how do you feel about what you're gonna earn now and also in like 20 years? Do you wanna go first?
I'll go first, yeah. I don't mind going first. I still have student loans from my chiropractic program and from my master's degree, and I graduated in 1997. All right, and I'd say that it's a reality, and I don't worry about it. I really want to have total wipeout of student loans. Why? Because there's inequity among healthcare practitioners, right? We don't always have the opportunity to have our own clinic or to work for somebody else. We had to go out and do it on our own. So that's why you do need to prepare yourself to network. I had to work maybe 2 or 3 jobs right out of school until I got established. I did a small business loan to help kind of buffer. So I had another 7-year loan on top of my $150,000 DC, and then another $50,000 for my nutrition program. And so it's just a reality. But I only pay, what, $100 a month right now because the Biden administration has helped to kind of cut that out. And then if I work here another 5 years, then I can get everything wiped out. For a nonprofit, so that's an advantage to work for a nonprofit. Okay, yeah. So just to give you that information, that it's just the way it is. And I think you can have some, there's a 5-year buffer before you actually have to start. And there's a forbearance period, 5-year, but you're also having interest on that. So, you know, if you want to do what you want to do and you have a passion for what you want to do, then you're going to take that risk. You're going to just kind of jump off the cliff and go for it, okay? But you have to determine if that's right for you on an individual basis, because it's scary also, I'm sure. But I'm telling you, be not afraid.
I am feeling pretty good, actually. And I think what it's shaking out to look like is I'm definitely making more than I did at the jobs before being able to do nutrition.